Good afternoon. Thank you for joining us here this afternoon. We are elated to announce that we have a settlement with the United Public Workers Union um, that would of the Maui regional hospitals from state control to the Maui Health Systems, a Kaiser Foundation Hospital LLC. The agreement provides certainty to the people of Maui County that they will continue to have access to high quality health care. The state and the UPW will jointly ask the Ninth Circuit Court of Appeals to lift its injunction and dismiss UPW's lawsuits. Just a couple of key points in the agreement. The Maui Region hospitals will be transferred from Hawaii Health Systems Corporation Management to Kaiser not earlier than November 6, 2016. The Maui Region hospitals will be operated and managed exclusively by Kaiser. UPW and bargaining unit employees will work under Kaiser supervision and direction and still be covered by the UPW collective bargaining agreements until those agreements expire on June 30th, 2017. And Kaiser will offer to hire UPW employees for a period of 6 months starting July 1st, 2017. So just wanted to thank all of the people of Maui for their patience as we move forward in this area. I just wanted to thank all of the employees who continue to provide in the best tradition of professionalism, quality health care to the people of Maui. And I'm open to answer any questions. We continue to talk with HGA to respond to any concerns that they have. As you know, the lawsuit was specific to UPW employees.
Are you negotiating with HGA separate from just the sideshow of the lawsuit on the ERS side?
Well, we will continue to work to resolve any issues with both HGA and UPW in order to move forward.
Governor, who asked for November 6th? Was it requested by you folks or Kaiser?
There's a lot of work involved with the transition, and that date was really a reflection of where we are today and what needs to occur in order to get prepared to do the transfer. And so, we will be working with Kaiser to, work through the details of what's required in order to do the transfer. So in all practical reality, we would not be prepared to do the transfer any earlier than November 6th.
What did you have to give up in order to get UPW to agree to this?
I think, and you'll see in the settlement, it really was about recognition of the state honoring the collective bargaining agreement. It really was working through looking at the collective bargaining agreement and collective bargaining law and being willing to discuss what the impacts on the employees were and finding a way to move forward.
But this allows UPW workers to stay UPW workers to the end of the contract. So how do you deal with HGA?
Well, we'll be having the same conversations or trying to look at what their interest would be. I would say that we have had conversations prior to this, and the motivations, the desires of the different unions are very different, and their employees are different. So we are focused on looking at and having that conversation with HGA to talk about the concerns that they have in transition and finding a way to move forward.
And so Kaiser is signed on and they're willing to keep them on the contract even though they're going to be managed by Kaiser managers?
Yes, we have been in discussion with Kaiser, and they are fully aware of the contents of the settlement agreement and are agreeable to work with us. Kaiser has been patient in this proceeding, and they've been very, very open to the discussions as was necessary in order for us to move forward.
Is there any indication as to whether Kaiser will pick up all of
I cannot stress those questions to them. They have made it very clear in all of our conversations that they are committed to 100% of the employees employed currently today, and probably more importantly, they are very active and they know that in order to fulfill the requirements of the transfer agreement, they know that they will eventually have to hire even more employees. So clearly, I think we do know that in order to fulfill the needs of the transfer agreement, that much more work is needed on behalf of Kaiser.
Does the state end up bearing the cost for another year of pension development for these workers? So like if the UPW person who might have transitioned out of UPW this year now is gonna be all the way in through the end of the contract, so they'll still be entitled to their pension and health benefits as provided in the contract, right?
Absolutely,
Okay, so
they would
there's a
be.
cost factor to the state in this, isn't there?
There is a cost factor to the state.
And can you
So
give an estimate of what that is?
it really would depend on the number of employees that seek to remain state employees. So, you know, we have been, essentially the budget is built on all of those employees remaining state employees anyway, so there wouldn't really be an added cost. It's already in the budget. Obviously, there are lots of challenges, and, you know, I continue to say that this is the most complex transaction that the state has ever entered into. And we will continue to work through all the details required to ensure a smooth transition.
Do the union, does the agreement cover what happens with new employees who are hired? Will they be starting off as UPW members and transitioning, or will they come in as non-union or whatever status under Kaiser, like the Teamsters?
You know, we are working through that. The general agreement is that they would come in as Kaiser employees.
Governor, the Health Systems Corporation now has 3 less hospitals. My understanding is still a financially troubled institution. With this agreement, which is working out of complex issue, might this be a template going forward for the other hospitals?
It could be considered that. I know that we'll have to work through that in each instance. As you know, Act 103 was really a collaboration between the legislature and the governor's office, but most importantly, it was driven by the Maui community. And I do think that that each community needs to be engaged in helping us determine what's the best way to provide quality health care.
Will the UPW workers who are separated, assuming that there are some, or are they gonna be given this option under the severance law of that bill?
We are working through the details. As you know, I am not willing to put at jeopardy the pension system. As you know, tens of thousands of public servants are part of the ERS system. We want to be clear that any action does not put at risk that situation. So we will continue to work through and find a way to move forward.
So, and I apologize for not knowing this. HGEA's contract, was it on the same timeline as the UPW contract?
Yes, it was.
So has HGEA been asking for the same consideration, and do you expect to have to give that to them?
You know, we will be having more detailed conversations with HGA to resolve any issues that they have. We definitely had different needs, and we are flexible in determining what's appropriate.
Because theoretically, I'm sorry to keep asking questions, but theoretically, if they remain union members through this transition period all the way into next year, then they would be eligible for the severance benefits and pension payouts that they might be eligible for as HGA members, which would kind of make the bill moot, right? Is that how you feel about that?
Well, I mean, there are lots of challenges with Senate Bill 2077, and we are working through that. As I said, I'm not going to put the pension systems for all public employees at risk. And so I think it's about working with the Board of Trustees on the ERS and finding a way forward. You know, we'll be definitely having conversations with the unions about how best to proceed.
So I get this straight, so HGA, right now, they do, is, are not entitled to remain HGA members all the way through the end of their contract, right? As of today.
Right now, Act 103 requires that they are transferred at the transferred date.
So this agreement with UPW could be a template for an agreement with HGA, is that?
Yes, it could serve as that.
Have you, scheduled any talks with, Randy Prepared's, union?
We don't have anything specific scheduled at this time. We are reaching out and wanting to engage in discussions.
How soon do you expect to get the ERS, suit resolved?
You know, we're working very hard to get a determination from the IRS as soon as possible. But, you know, that's really outside of our hands. We have made the request and we've proceeding to try and get a ruling from the IRS as soon as possible.
Can you clarify who UPW represents and who HGA is?
So UPW represents about 536 employees, I think is the last count, plus or minus a few. You know, a lot of their are you know, the blue collar positions in the hospital. So, you know, it does deal with maintenance and food service and laundry and a whole bunch of those kinds of functions. Some of the I believe nursing assistants and some others as well. So and then HG are nurses and supervisors and technical. Yes, it's about 900 and something. We can give it right. We definitely can get you that number.
But the UPW workers are also members of the HGA union, or they?
No, totally separate. Right.
So the ERS suit, though, I mean, because you've got the workers as, they remain government workers until the end of the contract. I still am really unclear as to how the ERS suit will affect this, because.
Well, so as you know, the law is now Senate Bill 2077, and employees impacted by the transition would be eligible for separation benefits or retirement benefits. And so we are working through the of allowing us to move forward. As noted in my veto message, the measure is not funded anyway. So we definitely would have to seek funding from the legislature to implement the measure.
Does that mean that you would have to wait until the next legislative session started, or could you call a special session to try to appropriate funds, general funds?
Right, either of those would be options. I think the main objective is to have the discussions with HGA and respond to their concerns and issues that would allow us to move forward. And then depending on what that outcome is, I would have a conversation with the legislature about how they might want to proceed.
Any other questions? You guys good? Okay. Thank you.
Thank you all very much.